Hello there, welcome to Dr. Sushant's anatomy tutorial. In today's video, I am going to talk about the anterior compartment of the arm. The anterior compartment of the arm is also known as the front of arm because it contains the muscles which flex the arm. It is also known as the flexor compartment of the arm, and the other name is anterior compartment. So anterior compartment, front of arm, or the flexor compartment of arm all mean the same. Now the arm consists of two compartments. There is an anterior compartment and a posterior compartment. These compartments are separated from each other by medial and lateral intermuscular septa. We all know that the deep fascia covering the arm is called the brachial fascia. So this brachial fascia encloses the muscles and the other structures of the arm as a tight sleeve. So the deep fascia here is called the brachial fascia. It's like a stocking that's going to keep the structures of the arm together. So here is the transverse section of the arm. In the center, we see the humerus bone that is cut transversely. Now this is the lateral aspect, this is medial. So let me label it. So this is lateral, this is medial. So on the medial aspect, we see an extension from the deep fascia, that is the brachial fascia, all the way up to the medial border of the shaft of the humerus. This is called the medial intermuscular septum. Similarly, on the lateral side, there is the extension from the brachial fascia to the lateral border of the humerus, and this is known as the lateral intermuscular septum. These septa, medial and lateral intermuscular septa, are more pronounced in the lower half of the arm, where these are attached on the medial and the lateral supracondylar ridges. So these septa are pierced by nerves and vessels. So the medial intermuscular septum, it is pierced by the ulnar. So medial intermuscular septum is pierced by the ulnar nerve and the superior ulnar collateral artery. That's a branch of the brachial artery. Now the lateral intermuscular septum is pierced by the radial nerve and the anterior radial collateral artery, or the anterior descending artery. That's a branch of the profunda brachii artery. So these are the medial and lateral intermuscular septa, and this is going to divide the arm into two compartments. So there is a compartment containing muscles, vessels and nerves in front of the medial and lateral intermuscular septum, and this is called the anterior compartment of the arm. Similarly, lying behind the medial and the lateral intermuscular septa is the posterior compartment of the arm. There are three muscles in the anterior compartment of the arm, and there is the brachial artery, and we have nerves there such as the musculocutaneous nerve, median nerve, ulnar nerve. And in the posterior compartment, we have the only one muscle, the triceps brachii muscle, with one nerve, that is the radial nerve. Well, that's an introduction to the arm. Moving on to the compartments of the arm. Like I mentioned, there are two compartments. There is an anterior compartment that lies in front of the medial and the lateral intermuscular septum, and there is the posterior compartment which lies behind the medial and lateral intermuscular septa. So this shows the anterior compartment. This picture shows the posterior compartment of the arm. First, let us talk about the anterior compartment of the arm. So what are the contents of the anterior compartment of the arm? So in the anterior compartment of the arm, we have muscles, we have vessels, we have nerves, and these are, so the muscles are three muscles in the anterior compartment: the coracobrachialis muscle, the biceps brachii muscle, and the brachialis muscle. And the artery here, there's just one artery, that is the brachial artery. And the veins, there are superficial veins and deep veins. The superficial veins are the basilic vein that runs along the medial aspect of the biceps brachii muscle, and the cephalic vein that runs along the lateral aspect of the biceps brachii muscle. The deep veins, two in number, accompany the brachial artery and are known as the vena comitans. And the nerves here are the musculocutaneous nerve, the median nerve, the ulnar nerve, and we also have the cutaneous nerves, the medial cutaneous nerve of forearm running in the arm, while the radial nerve runs in the posterior compartment, but it comes to lie in the anterior compartment in the lower half of the arm. So these are the muscles in the anterior compartment of the arm: the coracobrachialis, the biceps brachii, and the brachialis muscles. So this coracobrachialis muscle lies here. It can be seen here. That's most medial muscle in the front of arm. And then there is the biceps brachii muscle that has got two heads of origin. That's why it's called the biceps. The belly of the biceps has been cut here, so we don't see the belly of the biceps brachii muscle. And then the third muscle here is the brachialis. The brachialis muscle lies here beneath the biceps brachii muscle. So these are the muscles of the front of the arm. Now let us talk about each of these muscles in detail. The first muscle I want to discuss here is the coracobrachialis muscle. So the coracobrachialis muscle, it's actually a small muscle, short muscle in fact, and it arises from the tip of the coracoid process of the scapula. And from there the muscle passes downwards and laterally, and it inserts by fleshy fibers into the middle of medial border of the shaft of the humerus. Now we should also remember that the origin of the coracobrachialis is along with or together with the short head of biceps brachii muscle. So the short head of biceps brachii muscle along with the coracobrachialis, they both arise from the tip of the coracoid process. So when you look at the muscle coracobrachialis, it crosses only one joint, that is the shoulder joint. Now what about the nerve supply of the coracobrachialis muscle? The coracobrachialis muscle is supplied by the musculocutaneous nerve. In fact, musculocutaneous nerve pierces the coracobrachialis muscle. Basically it passes between the two heads of the coracobrachialis muscle. All right, so we will discuss about the morphology of the coracobrachialis in a bit. So before that, I want you to remember that the nerve supply of the coracobrachialis muscle is by the musculocutaneous nerve. Now let us just write down the attachments of the the coracobrachialis muscle. So the attachments. So when we talk about the attachments of a muscle, it means that you are going to talk about its origin and insertion. First, let's talk about the origin of coracobrachialis muscle. So the origin of the coracobrachialis muscle is from the tip of the coracoid process of the scapula, in common origin with the short head of biceps brachii muscle. That's the origin. Now coming to the insertion of the coracobrachialis muscle, it is inserted to the middle of medial border of the shaft of the humerus, right? So that's the insertion of the coracobrachialis muscle, and this is exactly where there is the nutrient foramen of the humerus. All right, and what about the nerve supply? The nerve supply of the coracobrachialis muscle is by the musculocutaneous nerve. So the musculocutaneous nerve, we all know that it arises from the lateral cord of the brachial plexus, and its root value, these are the root values C5, C6 and C7. Right, so this is the attachments and the nerve supply of the coracobrachialis muscle. Right, and please remember that the coracobrachialis muscle is pierced by the musculocutaneous nerve, or it would be more appropriate to say that the musculocutaneous nerve passes between the two heads of the coracobrachialis. Now, let us take a look at the anterior compartment of the arm and the muscles there. So here is the anterior compartment of the arm. So we know that the arm extends from the shoulder joint to the elbow joint, and there is the skin here covering the arm, of course, and we have the cutaneous nerve supplying the skin. The cutaneous nerves here are the medial cutaneous nerve of arm that comes from the medial cord of the brachial plexus. We also have this nerve communicating with the intercostobrachial nerve, which is the undivided lateral cutaneous branch of the second thoracic spinal nerve, also supplying the arm. And we have the upper and the lower lateral cutaneous nerves of the arm, and then we have the posterior cutaneous nerve of the arm. So these are the cutaneous nerves supplying the arm, right? So we can see these dermatomes here. So we have the C5 dermatome, the C6 dermatome. We also have the C8 dermatome covering the skin of the arm. So C5, C6, C7, C8 dermatomes basically supply the skin of the arm. So once we remove the skin, what we see, let's remove the skin. So we see the deep fascia. Right, now what is the deep fascia of the arm called? The deep fascia of the arm called the brachial fascia. So this highlighted structure is the deep fascia of the arm, which is known as the brachial fascia. So this brachial fascia, it covers the entire arm like a sleeve, and it sends medial and lateral intermuscular septa to be attached to the medial and the lateral borders of the humerus, forming medial and lateral intermuscular septa, and thereby dividing the arm into anterior and posterior compartments. Now let us remove the deep fascia. So when I remove the deep fascia, I can see the muscles of the front of arm. The most prominent muscle that I see here is the biceps brachii muscle with two heads, the long head and the short head. Let us also remove the pectoral muscles so that we can expose the origin points of the biceps brachii muscle and the other muscles, of course, of the anterior compartment of the arm. So I've removed the deltoid muscle and the pectoralis major muscle. So also remove the pectoralis minor muscle. So when we remove all these, there was the clavipectoral fascia which I just removed. Now I remove the pectoralis minor. Now we get a better view of the muscles. Let us remove the veins, arteries and the nerves, also the lymphatics, so that we see only the muscles now. So the muscle here, this is the biceps brachii with the long head and the short head, and then we see the coracobrachialis muscle. This coracobrachialis muscle, just hide the biceps brachii muscle. When I hide the biceps brachii muscle, the long head of it, sorry, the short head of the biceps brachii, I see the coracobrachialis muscle. So this is the coracobrachialis muscle taking its origin from the tip of the coracoid process of the scapula and is getting inserted to the middle of medial border of shaft of the humerus. Right, so that's the origin and insertion of the coracobrachialis muscle. Now let us try to add the nerve supply, that is the musculocutaneous nerve. See, all these visual inputs will really help you understand and remember the concept better. Okay, so I go really slowly, so that is an added advantage for you. Now see this nerve. That's the musculocutaneous nerve. So it comes from the lateral cord of the brachial plexus and can be seen piercing the coracobrachialis muscle. And it supplies the other muscles of the arm also. And after supplying the coracobrachialis, it passes further down to supply the the biceps brachii muscle, and it sends a twig to supply the brachialis muscle also. So after supplying the muscles of the anterior compartment, becomes the lateral cutaneous nerve of the forearm. So that's about the coracobrachialis muscle. Now let us talk about the morphology of the coracobrachialis muscle. Right, so what's the morphology of the coracobrachialis muscle? So the coracobrachialis muscle, its morphology. So this muscle is actually a member of the adductor compartment of the arm, which is not existing now as of now due to evolution. The coracobrachialis in the adductor compartment or the medial compartment, that concept is non-existent as of now. So the coracobrachialis is considered with the anterior compartment of the arm, but there was a time when the coracobrachialis muscle was a member of the adductor compartment of the arm, meaning there was an additional compartment in the arm. There was the medial compartment, and the muscle in the medial compartment was the coracobrachialis muscle. It is no more existing now. We only have two compartments in the arm, that's the anterior, and the other one is the posterior. All right, so this is actually an insignificant compartment as far as evolved humans are concerned. So morphology of the coracobrachialis represents the adductor. It represents the adductor muscle of the arm, but such action is insignificant in man. Okay. Now in some mammals, the coracobrachialis is a tricipital in origin, meaning in some mammals it has three heads of origin. Okay, and the upper two heads are fused. Okay, upper two heads are fused, and the musculocutaneous nerve passes in between the two heads, and these two heads take their origin from the tip of the coracoid process. All right, enclosing the musculocutaneous nerve in between them. The lower head is usually suppressed in man. Okay, the lower head is usually suppressed in man. That is believed to be due to evolution. Sometimes the third head of the coracobrachialis is represented by a fibrous band, which is known as the ligament of Struthers. Okay, so this Struthers ligament of Struthers, this is not always present. It is occasionally present. When it is present, it will be attached to something called the supratrochlear spur. Supratrochlear spur. All right, so what is the ligament of Struthers? It is the third head of the coracobrachialis, which is not present in humans as on today. Okay, so when it was present, it would be attached to the supratrochlear spur. So this supratrochlear spur is present on the anteromedial surface of the humerus. Okay, this is present about 5 centimeters above the medial epicondyle. Right, that's called supratrochlear spur, anteromedial surface of the lower part of the humerus, and from there this will extend up to the medial epicondyle. So if I represent it, if I just draw the lower end of the humerus, let me show you. So the lower part of the humerus, the medial epicondyle, the medial flange, the lateral flange, the capitulum, the lateral epicondyle. Okay, So here is the capitulum and this trochlea, and here is the radial fossa, the coronoid fossa. All right, so this supratrochlear spur, it is present like a spine-like structure, and the ligament of Struthers will be attached from the tip of this supratrochlear spur to the medial epicondyle like this. So always you represent the ligament with the green color. So this is the Struthers ligament when it is present. Okay, it's not always present. When it is present, it will be attached between the tip of supratrochlear spur and the medial epicondyle. So the median nerve and the brachial arteries usually pass beneath these structures. So this structure in yellow color is the median nerve, and the brachial artery also passes deep to the, when you represent in dotted lines, it means it passes deep to that structure. So median nerve and the brachial artery pass deep to the ligament. So when this ligament stretches, it is going to compress these structures, that is the median nerve and the brachial artery, and this produces vascular spasm or the median nerve palsy. Okay, vascular spasm, or that is when the brachial artery is compressed, giving rise to vascular spasm, and when the median nerve is compressed, it is going to give median nerve palsy. So this is the morphology of the coracobrachialis and its importance when the Struthers ligament is present. Right, now I believe we are ready for the next muscle. Let's see what is here. Yeah, the morphology of the coracobrachialis. So I've already demonstrated this. This is the Struthers ligament, when we can see the median nerve and the brachial artery passing deep to the Struthers ligament. And when this ligament stretches, it's going to compress the brachial artery, giving rise to vascular spasm, and the median nerve giving rise to median nerve palsy. Now, at the insertion of the coracobrachialis muscle, there are a lot of changes taking place in the arm. So what are these changes taking place at the insertion of the coracobrachialis? So insertion of the coracobrachialis actually takes place in the middle of the arm, and there we find the nutrient artery entering the humerus. So like I mentioned, at the insertion of the coracobrachialis, there is going to be the nutrient foramen. So we have the nutrient artery passing through the nutrient foramen, and it passes, there is a passage for the nutrient artery to pass, and it passes downwards. Therefore, the growing end of the humerus is upwards. And we also have the origin of the brachialis at the same place as the insertion of the coracobrachialis. We have the insertion of the deltoid muscle to the deltoid tuberosity. We have the insertion of course, the coracobrachialis muscle, and we have the radial nerve emerging from the spiral groove. Right, from the axilla, the radial nerve passes through the lower triangular space, and then it enters the spiral groove, and later it pierces the lateral intramuscular septum. So before it does, it lies in the spiral groove, and it emerges from the spiral groove at the level of insertion of the coracobrachialis muscle. We also have the basilic vein perforating the deep fascia. The basilic vein perforates the deep fascia in the middle of the arm at the insertion of the coracobrachialis muscle, and it is joined by the vena comitans of the brachial artery, and these three veins together form the axillary vein. So then we have the median nerve crossing anterior to the brachial artery. Right, until the middle of the arm, the median nerve lies on the lateral aspect. It is formed, the median nerve is formed lateral to the third part of the axillary artery, and it crosses from there in front of the brachial artery, and then it comes to medial side of the arm. We know the content of the cubital fossa, where the median nerve lies medial to the brachial artery. So that happens. Also, we have the ulnar nerve and the superior ulnar collateral arteries piercing the medial intramuscular septum, and we also have the ulnar nerve and superior ulnar collateral artery passing posteriorly through the medial intramuscular septum. So after piercing the medial intramuscular septa at the level of insertion of coracobrachialis, the ulnar nerve and the superior ulnar collateral artery passes to the posterior compartment of the arm. So these are the various events that take place at the site of insertion of the coracobrachialis muscle. Now the second muscle here is the biceps brachii muscle. Right, so the biceps is one of the much talked about muscles in men, right? Yeah. So biceps brachii muscle. So why it is called biceps? It has got two heads of origin. That's why it's called biceps. Bi means two, sepa refers to the head. Because it is in the arm, the brachium, it's called the biceps brachii. We also have biceps femoris muscle, which is in the lower limb. So this is biceps brachii muscle. So this muscle is highlighted in blue color or the purple color in this picture. So we see the short head and the long head of the biceps brachii muscle. Both pictures, the long and the short heads can be seen. So this is the short head of the biceps brachii taking origin from the tip of the coracoid process, and here is the long head that is intracapsular in origin, right? So this biceps brachii muscle is actually an elongated muscle, and it's fusiform, as you can tell. Now let us add the muscles here. Yeah, so this muscle here is the biceps brachii muscle, right? We all know where our biceps brachii muscle lies, right? So let me again hide the pectoralis major muscle and the deltoid muscle so that we can see the heads of the biceps brachii properly. So like I was telling you, there are two heads of origin for the biceps brachii. So there is the short head of the biceps brachii. So the short head of biceps brachii lies medial to the long head of the biceps brachii muscle. So here is the origin of the short head of biceps brachii muscle in common with the origin of the coracobrachialis. We see the coracobrachialis here. This is the coracobrachialis muscle. We discussed about this muscle and the biceps brachii. Now see, this is the short head arising from the tip of the coracoid process, right? And the long head, look at the long head, it arises from within the capsule of the shoulder joint, and it arises from something called the supraglenoid tubercle of the scapula, the supraglenoid tubercle. So that's the intracapsular origin. So the peculiarity of origin of long head of biceps brachii is that it arises from within the fibrous capsule of the shoulder joint, from the supraglenoid tubercle of the scapula. And it also takes its origin from the adjacent labrum, that is the glenoidal labrum. Now when you look at the tendon, it curves laterally above the head of the humerus, and it is enclosed in a synovial sheath. The synovial sheath is not shown in this picture because I've isolated the muscle, so the synovial sheath is not actually seen. And as you can see, it emerges beneath the transverse humeral ligament. So where is the transverse humeral ligament? The transverse humeral ligament will be bridging the greater and the lesser tubercles with each other. So this transverse humeral ligament actually keeps the long head of biceps brachii in the bicipital groove, right? So in the bicipital groove lies the long head of the biceps brachii, and that is the reason why this intertubercular sulcus is called, or is also known as, the bicipital groove. Now both these heads unite to form a fusiform shaped muscle belly. Okay, so they join usually about 7 centimeters above the elbow joint. Okay, so they completely fuse about 7 centimeters above the elbow joint, and then they form a flat belly. Okay, so a flat tendon, and then they form, after the belly they form a flat tendon, and this tendon passes further down for insertion. Now let us talk about the insertion of the biceps brachii muscle. Now the biceps brachii muscle is inserted to the radius. We all know that. Where exactly? The biceps tendon is inserted to the posterior rough part of the radial tuberosity. So that's the insertion of the biceps brachii muscle, right? So this tendon passes through the the cubital fossa, right? One of the contents of the cubital fossa is the tendon of the biceps brachii muscle. right? So the tendon passes through the the cubital fossa. In the cubital fossa, it's the most lateral structure, all right, except for the radial nerve. The radial nerve is the most lateral structure, but the other three structures, we have the median nerve most medially, brachial artery in the middle, and the tendon of the biceps brachii lying lateral to it. So when we consider only these three structures, the tendon of biceps brachii lies lateral to the other two. Now, before insertion, the biceps brachii muscle, the tendon of biceps brachii, sends something called the bicipital aponeurosis. As you can see here, this expansion is the bicipital aponeurosis. This bicipital aponeurosis arises from the medial border of the tendon of biceps brachii, and it runs downwards and medially. Right, and it attaches to the upper part of the subcutaneous posterior border of the ulna. Right, so there it blends with the deep fascia of the forearm, that is the antebrachial fascia. So that's the bicipital aponeurosis, and the bicipital aponeurosis lies on the roof of a cubital fossa, and it basically separates the median cubital vein from the brachial artery. Right, so it lies in between this vein, there is median cubital vein and the brachial artery. Now when you look at the nerve supply of the biceps brachii muscle, so this is also supplied by the musculocutaneous nerve. Okay, so the musculocutaneous nerve supplies not only coracobrachialis but also the biceps brachii muscle. Just remember, all the muscles of front of arm are supplied by musculocutaneous nerve. All the three muscles, biceps brachii, coracobrachialis, and brachialis. However, brachialis has an additional nerve innervation that is received from the radial nerve. All right, so that's the biceps brachii muscle. Now coming to the actions of the biceps brachii muscle. Okay, this is very important. The actions of the biceps brachii muscle is it is a powerful supinator of the forearm. Even though it is a muscle of front of arm, it is actually a weak flexor of the elbow joint. All right, it also crosses the shoulder joint, so it's a weak flexor of the shoulder, it's a weak flexor of the elbow joint, and it's a flexor of the elbow joint by the spurt action, and it flexes in a supinated position, but it is a powerful supinator in a semi-flexed elbow, as in screw in movement. So this muscle is the one that is helping you screw in, all right, by the supination, the action of supination. So biceps brachii is a powerful supinator, it's a weak flexor of the shoulder joint, and it's a flexor of the elbow joint by spurt action, and best acts in semi-flexed. As far as supination is concerned, as far as flexion of the elbow is concerned, it is in supinated position. Best acts in supinated position. So flexion of weak flexor of shoulder, flexor of elbow by spurt action, and it best flexes in supinated position, and it's a powerful supinator, and it is most powerful in semi-flexed elbow. All right, so that's about the biceps brachii muscle. I hope that's clear to you, right? So we discussed the origin and insertion, the nerve supply of the biceps brachii muscles. Now the third and the last muscle in front of arm is the brachialis muscle. Right, this brachialis muscle is a bulky muscle like the biceps brachii muscle, and as you can see, it takes its origin from the shaft of the humerus, and it lies beneath the biceps brachii muscle. Right, so the origin of a brachialis muscle. So it arises from the anteromedial and anterolateral surfaces of the lower half of the shaft of the humerus. All right, so it arises from anteromedial, anterolateral half of the shaft of the humerus, and it embraces the deltoid insertion. Okay, as you can see, the insertion of the deltoid muscle is here, V-shaped deltoid tuberosity. So the origin is embraced by the brachialis muscle, and some of the fibers of the brachialis arise from the medial intermuscular septum. So that's about the origin of the brachialis muscle. Now let's take a look at the brachialis muscle. Let me hide the biceps brachii. So we see this muscle here. This is the brachialis. The muscle that's highlighted is the brachialis muscle. Okay, so the brachialis muscle takes its origin from the anterolateral and anteromedial surface of the shaft of the humerus. So we know the shaft of the humerus presents an anterior border, a medial border, and a lateral border. Right? The surfaces are anteromedial surface, anterolateral surface, and posterior surface. So the origin of brachialis muscle, the principal origin of brachialis muscle is from the lower half of the anteromedial and the anterolateral surface of the shaft of the humerus. It also takes origin from the medial intermuscular septum, and at the origin it embraces the insertion of the deltoid muscle. Now, what about the insertion of the brachialis muscle? So the brachialis muscle is actually a broad muscle, as you can see. It covers the anterior part of the elbow joint, and it forms the floor, upper medial part of floor of the cubital fossa, right? And then it forms a flat tendon, as you can see. This is the flat tendon of the brachialis muscle, and it is inserted into the anterior surface of the coronoid process and the tuberosity of the ulna. Right, so it is inserted to the coronoid process and the ulnar tuberosity. Biceps brachii is inserted to the radial tuberosity. Brachialis muscle is inserted to the ulnar tuberosity and to the anterior surface of the coronoid process of the ulna. I believe you know the coronoid process of the ulna, right? So that's the insertion of the brachialis muscle. Now, what about the nerve supply of the brachialis? The brachialis muscle is supplied on its medial half by the musculocutaneous nerve, and the small lateral part of the muscle is supplied by the radial nerve. Okay, so it is a composite muscle having two innervations, mainly by the musculocutaneous nerve and a small part of it by the radial nerve. Now, when we talk about the actions of the brachialis muscle, the action of the brachialis muscle is to flex the elbow joint. All right, so it is the principal flexor of the elbow joint. The coracobrachialis is a weak flexor of the shoulder joint. Okay, it flexes the shoulder joint. All right, the coracobrachialis muscle, it crosses only one joint, that's the shoulder joint. The biceps brachii crosses two joints, shoulder joint, elbow joint. At both joints it is flexor, but weak flexor. Okay, and the brachialis muscle crosses only the elbow joint, and it is the principal flexor muscle of the elbow joint. Right, so these are the muscles of front of arm. In addition to these, we also have the origins of brachioradialis and extensor carpi radialis longus muscles. The brachioradialis arises from the upper two-thirds of the lateral intermuscular septum, and the extensor carpi radialis longus from the lower one-third of the lateral intermuscular septum, that is from the supracondylar ridge to be exact. Brachioradialis from the upper two-thirds of lateral supracondylar ridge, and the extensor carpi radialis longus from the lower one-third of the lateral supracondylar ridge. So these muscles have a part of their origin from the arm. Okay, so they are not muscles of arm, they only have their origins in the arm. All right, well, so that's about the muscles of the front of arm. Next, we have the artery in the arm, right? So the artery in the arm is the brachial artery, right? So the brachial artery begins as a continuation of the axillary artery, and the origin of the brachial artery is actually at the lower border of the teres major muscle. So here we have the teres major muscle. So at the lower border of the teres major muscle, we have the origin of the brachial artery. All right, so when we discuss an artery, you have to discuss it under certain headings. That is origin of the artery, and then the termination of the artery, its course, relations, branches, and distribution. Okay, so the origin of the brachial artery is it arises as a continuation of the axillary artery to the distal border of teres major muscle, and it runs downwards, okay, at first, and lies medial to the humerus, and then it slowly inclines to lie in front of the bone, okay, until it appears in the cubital fossa. See, when it reaches the cubital fossa, you can see it lies anterior to the humerus, whereas here in the upper part it lies medial to the humerus. It slowly crosses from medial to, that is medial to the bone, to the front of bone. It happens somewhere in the middle of the shaft. That's where it is going to cross. All right, so in the cubital fossa, the brachial artery ends by dividing into radial and ulnar arteries. So the origin is continuation of the axillary artery at the lower border of teres major, and the termination of the brachial artery is in the cubital fossa at the neck of the radius by dividing into radial artery and the ulnar arteries. Okay, so the brachial artery is actually very much superficial throughout its course, that is from origin to termination. So that is the course of the artery, from origin to termination, the path taken by the artery, that's the course of the artery. So when you talk about the course of the brachial artery, it lies superficial throughout, and its course in the arm, it lies immediately deep to the deep fascia. Okay, it is fairly superficial throughout its course in the arm, but it lies immediately deep to the deep fascia, and it is accompanied by a pair of venae comitans. All right, so that's the course. Now coming to the relations of the brachial artery. All right, so when we talk about the relations of the brachial artery, let me show you the brachial artery here. Let me introduce the artery. So let me remove the muscles. So we see the artery here. This is the brachial artery. You can see it is passing from the medial aspect of the humerus. So here, medial aspect of the humerus, and it comes to lie in front of the cubital fossa, and in the cubital fossa you can see that it's dividing into the ulnar artery and the radial artery. All right, so this nerve, the artery, is crossed by the median nerve in the middle of the arm. As you can see, this is the median nerve crossing the brachial artery from lateral to medial side. Take a look. It's crossing the artery from the lateral to medial side, meaning in the upper part the median nerve lies lateral to the brachial artery, in the middle it lies anterior to the artery, in the lower part the median nerve lies medial to the brachial artery. All right, so at the cubital fossa the brachial artery is crossed by the bicipital aponeurosis. So this bicipital aponeurosis basically lies superficial to the brachial artery, and this bicipital aponeurosis separates the brachial artery from the median cubital vein. All right, now what are the structures lying posterior to the brachial artery? So posteriorly we have the long head of the triceps brachii muscle. Let me add the muscles here. So underneath the so brachialis muscle, so I see this is the intermuscular septum, that is the lateral intermuscular septum, this is the medial intermuscular septum. Now when you look at the posterior relations of the brachial artery, it lies on the long head of the triceps brachii muscle, and it is separated from it by the radial nerve, right? So here is the long head of the triceps brachii muscle. So posterior relation, immediate posterior relation of the brachial artery is the triceps brachii, and separating the long head of triceps brachii from the brachial artery is a radial nerve. Okay, and then we also have the largest branch of the brachial artery, that is the arteria profunda brachii. That's one of the largest branches of the brachial artery. It also lies posterior to the brachial artery. And laterally, we have the median nerve. So what is the structure lying lateral to the brachial artery? So here is the brachial artery. So in the upper part, we can see lying lateral to it is the median nerve. And we also have the coracobrachialis muscle. So the lateral relation in the upper part is coracobrachialis muscle and the median nerve, right? In the lower part, lying lateral to the brachial artery would be the biceps brachii muscle. So I just removed the biceps brachii muscle. So if I add the biceps brachii muscle, so biceps forms the lateral relation of the brachial artery. Okay, so here, every time it rotates, see. So this biceps brachii lies lateral to the, so it is actually covering the artery, so it's not very clear. Anyway, so the in the lower part, the biceps brachii lies lateral to the artery. So medially, when you look at the medial relation, the medial cutaneous nerve of the forearm and the ulnar nerves lie medial to the brachial artery in the upper part, as you can see. So here is the ulnar nerve. This is the ulnar nerve that lies medial to the brachial artery. And we also have the medial cutaneous nerve of the arm that also lies medially to the brachial artery in the upper part. In the lower part, the median nerve lies medial to the brachial artery. So here is the brachial artery. Lower part, the median nerve lies medial to the brachial artery. So this can be a little boring to you, like when I'm describing the relations of the brachial artery. So I'll try to make it a bit simpler by just writing down the relations. Okay. So relations is very important when you actually perform any surgical procedures in any part of the body. So you need to know what lies to the right of the structure that you're going to operate on, what lies to its left, what lies in front of it, what lies behind it, what lies above it, what lies below it, because you do not want to cut any of these structures while performing the surgery, right? And that is the importance of knowing the relations of any structure in your body. Okay, in anatomy, the relation is very, very important. So let me simplify the relation of the brachial artery for you. Okay, so the brachial artery, so we discussed the brachial artery in this heading. So origin of the brachial artery, the termination of the brachial artery, okay, and its course, that is from origin to termination. What is the path taken by the artery? That's the course. I've already explained it to you. So next part is its relations. Okay, so relations, as far as the relations is concerned, what is anterior to the artery, what lies posterior to the artery, what lies medial to the artery, and what lies lateral to the artery. So this is basically the relations. Sometimes we will also have superior and inferior relations added to it. Okay, so what is the anterior relation? The median nerve. The median nerve crosses the brachial artery anteriorly at the middle of the arm. Okay, so initially the median nerve is lateral, okay, and it comes to the front of the artery, then it goes to the medial aspect of the artery. Which one? The median nerve. So initially the median nerve is lateral to the artery, right? So if I draw the artery, so we have the, okay, so here is the shaft of the humerus, okay, shaft of the humerus, and the greater tubercle, head of the humerus, and below we have the other structures, and we have the median nerve here, okay, this passing downwards. We have the brachial artery also. So when we talk about the brachial artery, The brachial artery lies like this, and it is the median nerve that crosses it. Okay, this is not exactly the middle of the arm, so it actually should cross here. So let me redraw the artery, the brachial artery here. Okay, the median nerve is lateral to the artery, and at the middle of the arm the median nerve crosses in front and the median nerve becomes medial. Okay, so anterior, that is when the artery crosses here, that is anterior relation. So anteriorly we have the median nerve in the middle of the this thing. Okay, and we also have lying superficial to this at this point in the cubital fossa. Okay, not here, not here. In the cubital fossa there will be the bicipital aponeurosis that also lies anterior. So anteriorly we have the median nerve plus, so one structure is this, second one is the bicipital aponeurosis. Now what lies posterior to the artery? There lies the long head of triceps brachii muscle, long head of triceps brachii muscle, but separated by the radial nerve. Okay, so there is the radial nerve and the profunda brachii vessels. Okay, so posterior relation, long head of triceps brachii, radial nerve and profunda brachii vessels. That's the posterior relations. Now what about the medial relation? Medial relation is the medial cutaneous nerve of the forearm and the ulnar nerve. Okay, this is the relation in the upper part of the artery over here. Okay, so here we will have the upper part. This is the upper part. So we have the medial cutaneous nerve of forearm. It goes like this, and we also have the ulnar nerve. Okay, the ulnar nerve. So medial cutaneous nerve of forearm and the ulnar nerve in the upper part. Okay, they run like this. And in the lower part, what lies medial to the brachial artery is the median nerve, which you can tell looking at this. So here is the median nerve that becomes medial in the lower part. In the upper part, the median nerve is lateral to the brachial artery. You can see this yellow line the yellow line which represents the median nerve runs lateral to the brachial artery. That's the red line in the upper part. In the lower part, the yellow line goes medial to the red line. Okay, so that's the medial relation. So above the upper part, the medial relation is medial cutaneous nerve of forearm and the ulnar nerve, and the lower part, it is the median nerve that lies medial to this red line, that is the brachial artery. Okay, so this can be little complicated for you to understand, but trust me, once you read your textbook and try to understand the concept, it's going to be very easy for you. Okay, now what about the lateral relations? The median nerve and the coracobrachial is in the upper part, right? So look at this structure here that I've marked in blue color. This arrow shows you the median nerve. So this red line is the brachial artery. So in the upper part of the arm, the lateral relation would be the median nerve, and also we have the coracobrachialis muscle. In the lower part, what is the lateral relation? In the lower part, the lateral relation would be the biceps brachii muscle. Okay, so the biceps brachii muscle and its tendon, the biceps brachii muscle tendon will come here. So now we have the contents of the cubital fossa here. These three structures, that is the tan structures. This is the tendon of biceps brachii. This red line is the brachial artery, and this yellow structure is the nerve. Which nerve? The median nerve. So these tan structures. Okay, so what lies lateral to the artery is the tendon of biceps brachii. What lies medial to the artery is the nerve, median nerve. So basically, you have to understand that the median nerve crosses the brachial artery in front from lateral to medial side. So in the upper part, the median nerve will be lateral to the brachial artery. In the lower part, the median nerve will be medial to the brachial artery. Okay, and in the upper part, ulnar nerve and the medial cutaneous nerve of forearm lie medial to the brachial artery, and in the lower part, obviously it's the median nerve lying medial to the artery, and laterally in the upper part we have the median nerve before it crosses to medial side, and we also have the coracobrachialis muscle, and in the lower part of the brachial artery we have the biceps brachii tendon. Okay, so this is about the relations of the brachial artery. So the brachial artery gives you branches also in the arm. The largest branch being the profunda brachii artery. So the profunda brachii artery runs in the lower triangular space along with the radial nerve, and it gives branches, other branches like anterior descending branch, that is the radial collateral artery, and the other branches from the brachial artery are the superior ulnar collateral artery, this one, and we have the inferior ulnar collateral artery. It also gives you muscular branches and nutrient artery. Okay, so the branches, what are the branches of a brachial artery? Okay, so we talked about the origin, we talked the termination, course, the relations. Now coming to the branches of the brachial artery. So what are the branches of brachial artery? The most important, because it is the largest branch, is the profunda brachii artery. So this artery arises from the posterior aspect of the brachial artery. So that's the profunda brachii, largest branch. So next we have the superior ulnar collateral. Okay, superior ulnar collateral artery. So the superior ulnar collateral artery, it takes part in the formation of anastomosis around the elbow joint. And then we have the inferior ulnar collateral artery, and then we have the muscular branches that is going to supply the muscles of the front of arm, and then there is the nutrient artery. The nutrient artery is going to supply the humerus. Okay, so these are the branches from the brachial artery. Now the pulsation of the brachial artery is felt or auscultated in front of the elbow. Okay, so it is usually the standard method of recording the blood pressure. That's the brachial artery. Now moving on to the nerves in the arm. So we have the musculocutaneous nerve in the arm, we have the median nerve in the arm, we have the ulnar nerve in the arm, and we have the radial nerve in the arm. The radial nerve goes to the posterior compartment. Okay. Now the musculocutaneous nerve of the arm, right? So this is the nerve of the anterior compartment of the arm. It supplies all the muscles of the anterior compartment, that is biceps brachii, coracobrachialis, and the brachialis muscles. Okay, so the musculocutaneous nerve, after piercing the coracobrachialis muscle, right, it arises from the lateral cord of the brachial plexus. It then pierces the coracobrachialis muscle. Then the nerve passes obliquely downwards and laterally between the biceps brachii muscle and the brachialis muscle. Just take a look at this nerve here. Okay, so remove the arteries. Let's have only the muscles and the nerves. Okay, so that it'll be easy for us to relate it to all the muscles. We add all the muscles once. Okay, so the musculocutaneous nerve, we're going to talk about the musculocutaneous nerve. So the musculocutaneous nerve, it arises from the lateral cord of the brachial plexus, isn't it? So to locate the nerve, let us remove the biceps brachii muscle. Now here we see the musculocutaneous nerve piercing the coracobrachialis muscle coming from the lateral cord. Let me hide the pectoralis minor also. So this musculocutaneous nerve is actually coming from the lateral cord of the brachial plexus and pierces the coracobrachialis muscle and gives muscular branches to coracobrachialis, biceps brachii, and the brachialis muscle. After that, the nerve passes between the biceps brachii. I have already removed the muscle. That is how the musculocutaneous nerve is visible now. So there is the biceps brachii muscle covering this, And then the nerve passes further down, and beyond the elbow it forms what is called the lateral cutaneous nerve of the forearm. Okay, so now this nerve is called the lateral antebrachial cutaneous nerve, and this extends up to the wrist joint and supplies the skin of the lateral part of the forearm. So that's about the musculocutaneous nerve. So whenever you talk about a nerve also, you should discuss this in under the following headings, such as the formation of the nerve, termination of the nerve, course of the nerve, relation of the nerve, branches and distribution. Okay, also you have to add a note on its applied anatomy and a diagram. Okay, if you're going to write the nerve in your exams. Okay, these are the headings you should include. So the next nerve in the, so what are the muscles supplied by it? All the muscles of front of arm. Okay, the second nerve in the arm being the median nerve. Okay, so the median nerve is an important nerve. So it is formed in the axilla. How is the median nerve formed? It is formed by the joining of medial and the lateral roots of the cords, right? Medial root and lateral root. So here is the median nerve that is formed by the joining of medial and the lateral cords of the brachial plexus. Right. Now let me remove the brachialis muscle so that we can see the median nerve. So here is the median nerve that is formed from the medial and the lateral roots. So the median nerve passes downward. So initially it is it runs in close association with the brachial artery. So we discussed the relation between the brachial artery and the median nerve already. Okay, so after its formation in the axilla by the union of the medial and the lateral roots of the median nerve passes downwards along the lateral side of the third part of the axillary artery, and it appears in the arm. Okay, it appears in the arm. So in the upper part of the arm, the nerve lies lateral to the brachial artery. Let me add the artery. See, so in the upper part of the arm, here is the brachial artery, and this is the axillary artery, and it continues the brachial artery. So in the upper part of the arm, the median nerve lies lateral to the artery. In the middle of the arm, opposite the insertion of the coracobrachialis, it crosses in front of the brachial artery, right? And it goes to the medial side of the artery. So by the time it reaches the cubital fossa, the median nerve will be medial to the brachial artery. Okay, and then in the beyond the cubital fossa, it enters the forearm by passing between the two heads of the pronator teres muscle. Okay, so that's the story of the median nerve. So it doesn't end in the arm, it continues to the forearm, and we will talk more about the median nerve in the forearm, because we are confining our discussion only to the arm. So I will end it here. The median nerve enters the forearm passing between the two heads of the pronator teres. Okay, so rest of its course will be discussed with the forearm. As far as the arm is concerned, it arises from in the axilla by the joining of medial and lateral roots. It runs in the arm, initially lateral to the brachial artery, and crosses it in front of the brachial artery at the middle of the shaft at the insertion of coracobrachialis, and it comes to lie medially in the cubital fossa, and beyond the cubital fossa passes between the two heads of the pronator teres and enters the forearm. So in the arm, the median nerve gives only one branch, that is to the pronator teres. So even though the pronator teres is a muscle of the forearm, okay, it has its origin from the medial epicondyle of the humerus. So branch to the pronator teres arises from the median nerve while it is in the arm. Okay, so what are the branches of median nerve in the arm? It gives just one branch, that is to the pronator teres, and it may also give vascular branches to the brachial artery. There are no other significant branches given by the median nerve in the arm. So next we have the ulnar nerve. So the ulnar nerve arises from the medial cord of the brachial plexus. Now let us try to find the ulnar nerve. So the ulnar nerve actually passes, it's here. Okay, this is the ulnar nerve, as you can see, the ulnar nerve. So the ulnar nerve arises from the medial cord. So initially the ulnar nerve will be medial. Right? It will be medial. So it will be accompanied by the medial cutaneous nerve of forearm along the medial side of the upper part of the brachial artery. So what happens to the ulnar nerve in the middle? In the middle of the arm, the ulnar nerve pierces the medial intermuscular septum along with the superior ulnar collateral branch of the brachial artery. As you can see here, this is the median nerve. So here is the ulnar nerve. This is the superior ulnar collateral artery. This is the brachial artery. Okay. So here the ulnar nerve can be seen in this gap here. And this one is the ulnar nerve. So it lies medial to the brachial artery, and in the lower part it can be seen piercing the medial intermuscular septum along with the superior ulnar collateral, and that goes to the posterior part of the posterior compartment of the arm. All right, in the posterior compartment of the arm, it runs between the medial intermuscular septum, and it pierces. After piercing medial intermuscular septum, it goes to the lower part. There is a posterior part of the back of the arm, and it runs in front of medial head of the triceps brachii, right? And it enters the interval between the olecranon process and the medial epicondyle of the humerus. Okay, so the ulnar nerve, let's remove the muscles here. Okay, so here you can see the ulnar nerve passing along with the superior ulnar collateral. So the ulnar nerve, it passes to the back of arm, and then it runs in the interval between the olecranon process of the ulna. Here is the ulna with its olecranon process. This is the medial epicondyle, the lower end of the humerus with the medial epicondyle. So the nerve is now in between the olecranon process of the ulna and the medial epicondyle of the humerus. And then the nerve winds round the posterior part of the medial epicondyle. Okay, and then it comes to the front of forearm, then passes between the two heads of flexor carpi ulnaris, and then continues into the forearm. All right, so the ulnar nerve, formed from the medial cord of the brachial plexus in the axilla, runs medial to the third part of axillary artery, medial to the brachial artery, and then it runs along with the medial cutaneous nerve of forearm, pierces the medial intermuscular septum along with the superior ulnar collateral branch of brachial artery, comes to the posterior compartment of the arm, runs in front of medial head of triceps brachii muscle, and then it enters the interval between the medial epicondyle and the olecranon process of the ulna, and it runs in the sulcus nervi ulnaris, then proceeds to the forearm, passing between the two heads of the flexor carpi ulnaris muscle. That's how it reaches the forearm. Okay, right, so that's the story of the ulnar nerve. Does it give any branch in the arm? The ulnar nerve does not give any branch in the arm except the articular branches to the elbow joint. That's all the branches. Okay, so and one more nerve, that's the radial nerve. So for a very brief course, the radial nerve lies in the anterior compartment of the arm. So we all know the radial nerve is formed from the posterior cord of the brachial plexus, and lies posterior to the third part of the axillary artery, posterior to the brachial artery. Okay, and in the upper part of the arm, the radial nerve lies, it is accompanied by the profunda brachii artery, enters the lower triangular space. Okay, this is the deep brachial artery or the profunda brachial artery. This is the radial nerve. So the radial nerve and the profunda brachii arteries both run to the posterior compartment. Through the lower triangular space, it enters the posterior compartment of the arm and runs in the spiral groove. Only after piercing the lateral intermuscular septum, the radial nerve comes to the front of arm, front of the lateral epicondyle of the arm, where it divides into a superficial and deep branches. Okay. So for a very short course, the radial nerve will lie in the anterior compartment of the arm. That too, after piercing the lateral intermuscular septum. It lies in the anterior compartment, comes to lie in front of lateral epicondyle, where it divides into superficial branch and deep branch. All right. So these are the nerves in the arm. So we discussed the musculocutaneous nerve, the median nerve, the ulnar nerve, and the radial nerve in the arm. And we also discussed the artery in the arm, that is the brachial artery. And as far as the veins are concerned, we have the basilic vein running along the medial side of the biceps brachii and the cephalic vein running along the lateral side of the biceps brachii muscle. Right. So I believe that's all I wanted to share with you. So the musculocutaneous nerve, the median nerve, the ulnar nerve, okay, and the radial nerve, of course, the radial nerve. So these are the details of the anterior compartment of the forearm. So in today's class, we discussed these details here. So I gave you an introduction to the arm, right? And I told you about the subdivisions of the arm, meaning the compartments of the arm, compartments containing the anterior and the posterior compartment, and we chose to discuss the anterior compartment of the arm, where we know there are muscles here, we know there's an artery here, we know there are veins here, and we know there are nerves here. So muscles we discussed were three: coracobrachialis, biceps brachii, and the brachialis muscle. The artery is the brachial artery, and the veins are the basilic vein and the cephalic vein, and the nerves, musculocutaneous nerve, median nerve, the ulnar nerve, and the radial nerve. Thank you very much for the patience. In next video, we will talk about the posterior compartment of the arm. Thank you again.